Anatomy. First, we have the abdomen. What is meant by abdomen? It's a roughly cylindrical chamber. Extension from the inferior margin of the thorax, because it's the chest, and to the superior margin of the pelvis. And also the lower limb. This is about the abdomen. In this abdomen ratio itself, we have, in this session, we have the abdomen. What is meant by abdominal cavity, and we have to know what is meant by abdominal wall. Abdominal cavity is something called as a space inside the abdominal wall. Like abdominal cavity will be present inside the abdominal wall. Then what is meant by abdominal wall? Abdominal wall is a muscular and the facial structure which forms the outer boundary of the abdominal cavity. Very, very important. When you talk about the abdominal wall, they form the outer boundary of the abdominal cavity, but then the abdominal cavity is present inside the abdominal wall. And then we have the other thing called as inferior thoracic aperture. That inferior thoracic aperture is also called as a thoracic outlet. That is nothing but the lower opening of the thorax. And what they say about the inferior thoracic aperture, they will be they are the superior opening. When you're talking about the abdomen, what is the superior opening of the abdomen? It is the inferior thoracic aperture or the thoracic outlet, and it will be closed by the diaphragm which will separate the thorax from the abdomen, or they separate thorax and the abdomen. And then we have the two cases where inferiorly, like when you talk about the abdominal wall, they will be continuous with the pelvic wall in the pelvic at the pelvic inlet. Our pelvic inlet is nothing but the upper area of the true pelvis. True pelvis is something where the pelvic organs are located. And this pelvic inlet, if they ask if the pelvic inlet is superior pelvic aperture or the inferior pelvic aperture, you can say it as a superior pelvic aperture. Superior pelvic. And then superficially, the inferior limit of abdominal wall. When you talk about the abdominal wall's inferior limit will be there, right? That is the superior margin of the lower limb, because we already talked about the lower limb in the extension. Chamber enclosed by abdominal walls. Like when you talk about this abdominal wall, that there will be a chamber chamber enclosed by the abdominal wall. They have the large peritoneal cavity which freely communicates with the pelvic cavity. What is meant by this peritoneal cavity? It's a potential space which is present inside the abdominal cavity. And here was one example that you should able to remember. Think, okay? Balloon inside the box. That balloon we can call it as the abdominal cavity, and the box we can call it as the abdominal wall. So abdominal cavity, all they have the organs, and the abdominal wall is all about the muscle and the facial. And before understanding this peritoneal cavity, we have to know what is meant by peritoneum. Peritoneum is divided into two, parietal and visceral. Parietal, it will line the inner surface. When you talk about the abdominal wall, this abdominal wall inner surface will be there. Now when you talk about the abdominal wall, the inner surface of the abdominal wall will be surrounded by the parietal peritoneum, whereas the visceral peritoneum, it will surround the outer surface of the abdominal organs, not the wall, abdominal organs. And the space between the parietal and the visceral, we can call it as a peritoneal cavity. And then we have the 4 quadrant, and then we also have the 9 quadrant. The 4 quadrant, the elongated line, we can call it as a median line, and the sleeping line, we can call it as the transumbilical plane. So that for the straight line is the median plane, and the sleeping line is a transumbilical plane. And then we have the right upper quadrant, and then right lower quadrant, left upper quadrant, left lower quadrant. And then we have the nine quadrants. So in that 9 quadrants, the first right side, we have the right hypochondrium, and then the left hypochondrium. In the center, we have the epigastric. And the second column, the second thing, we have the right and left flank, and the in between we have the umbilical region. And then after that we have the right and left groin, and inside that we in between we have the pubic region. These are the 9 set of that quadrant. And here the 2 standing line, we can call it as the mid-clavicular plane. In that we said it as a median plane, but here we can say it as a mid-clavicular plane. And there are 2 sleeping lines. The first sleeping line is called a subcostal plane, and the last one is called as an intertubular plane. So next we are talking about the abdominal wall, which is very important. They are consist partly of the bone and mainly of the muscles. So what are the skeletal elements? When you talk about the skeletal elements, what are the skeletal elements? How many skeletal elements are there? 5 lumbar vertebrae will be there, like 5 lumbar vertebrae. These 5 lumbar vertebrae, like L1 to L5, they will have the intervening intervertebral disc, and we also have the expanded parts of the pelvic bones, that is the ischium pubis and the ischium pubis and the ilium. And then we have the bony components of the inferior thoracic wall, including the costal margin, the rib 11, rib 12, and the xiphoid process. Costal margin is also there. Costal margin is all about the cartilages of that 7th to 10th ribs. And when you talk about the inferior thoracic wall, because we talked about the bony components of the inferior thoracic wall, we talked about the 5 lumbar vertebrae, and then we have talked about the expanded parts of the pelvic bones and the bony components of the inferior thoracic wall. That is the inferior thoracic wall, in the sense it's a lower boundary of the thoracic cavity. And then the 11th and 12th ribs, we can call it as a floating ribs. And then we have the abdominal wall muscles, because we all talked about the bones. Now we are talking about the abdominal wall muscles. Here we have in the vertebral column, lateral to the vertebral column, we have the 3 muscles. They reinforce the posterior aspect of the they reinforce the posterior aspect of the wall, the abdominal wall. What does that means? It is quadratus lumborum, psoas major, iliacus muscles. And the next point is that the distal ends of the psoas major, like there are last 2 muscles, right? First we have the quadratus lumborum, next is the psoas major, and then the iliacus muscles, so which reinforce the posterior aspect of the back. And after that we have the last 2 muscles, like the distal ends of the psoas major and the iliacus muscle. They will just pass into the thigh, and they are the major flexures of the hip joint. And the lateral parts of the abdominal wall are formed by 3 layers. Okay, 3 layers of muscles, like 3 flat muscles. We know like 3 flat muscles and 1 vertical muscle. So what are these 3 flat muscles? Transversus abdominis, which is the deepest one, external oblique and the internal oblique. External oblique being the outermost thing, internal oblique is the middle one, and the transversus abdominis is being the deepest one. Anteriorly we have the segmented muscle called the rectus abdominis. That is this 6-pack, which is divided by the tendinous intersection, which will be divided by the tendinous intersection. They span the distance between the inferior thoracic wall. We have already found what is the inferior thoracic wall. Inferior thoracic wall is the lower boundary of the thoracic cavity. Inferior thoracic wall and the pelvic cavity. So this is the vertical muscle. The last one, the segmented muscle, is the anterior one, and it is the vertical muscle. That's it.